What is ICSI? Intracytoplasmic?
Intracytoplasmic
Sperm injection.
So we pick the best looking one, the brightest looking, best one.
Right.
We pick it and we said, you're going to be the special one. And then our embryologist chooses it specifically, and then he inserts it into the egg.
Directly
into the egg.
And we're going to talk about how we select those good-looking sperm. You're going to help us with how you pick the shape of the sperm and what qualities of the sperm are used to choose the best ones. So let's talk about sperm cells in general. What does a sperm cell look like, Victoria?
Okay. It looks like a little white tadpole.
Little tadpole.
Looks like a little tadpole. It just is like a little circle with a little flagella tail.
Yeah, so it has a head, a neck, and a tail.
It should. Not all do, and that's where my job comes in.
Yeah,
Not all do.
So let's say we have a couple come in and we don't really know what their problem is. We're going to examine the woman and check her out and whatnot. And evaluating a guy involves a semen analysis.
Yes.
And if a guy can produce a semen specimen, we can then analyze it in the lab. Now, I'm going to go right into what can be embarrassing for guys, Victoria. So let's take the embarrassment right off the table. Guys come into our office or any fertility clinic and have to make a semen specimen.
Yes.
That means they need to be comfortable doing what?
Ejaculating.
Ejaculating on command.
Yes.
And for some guys, it's no big deal. Boom, they're in and out 5 minutes, right? Some guys, it's a big deal. They're ashamed.
No, getting an erection in a place that's not your home is strange.
It's strange, isn't it?
I don't know it personally, but I imagine it would be very strange.
Yeah. So some guys, and sometimes they come from a religious background or a cultural background where it is frowned upon.
Yes. I've had men that came in there and did not know the terms for masturbation.
Right.
They did not know because in their culture, it's not discussed. It's not allowed outside of marriage or outside reproductive.
Yeah, outside of reproduction.
Yeah, reproduction.
So there's some challenges just in collecting a semen specimen sometimes, isn't there?
Yeah, for sure.
Now, in my clinic, I don't care how a guy collects. You know, we'll have the guy's wife come in, girlfriend, whatever. But where I trained, we had a lot of Orthodox Jews. And the only way they could collect was with a condom that had a pinhole in it. So they were having sexual relations, and it had the potential of creating a baby. Just so happens a condom with a pinhole in it, not many sperm are going to get out. So we had these special condoms that were not spermicidal. I mean, if you buy a condom for contraception, they say spermicidal. They're covered in sperm-killing chemicals. Yes. Can't do that.
And I don't think a lot of people know that. I feel like it can be written all over the box. They still don't know. I've had a man bring in a specimen before in a used condom. And we're like, you're just going to have to do this again because you compromised your own sample.
Right. So we can't, so the sperm can be, they're tough in some ways, yet they're sensitive to spermicides and temperature fluctuations.
Yes.
If a guy's going to collect at home, because let's say he's more comfortable at home, he can't bring it in getting cold in the middle of winter. Got to put it in a coat, bundle up, keep it warm.
Keep it as close to body temperature as possible.
So there you go. There's a hint, or there's a pointer right there. And in the summer, if it's baking hot, you shouldn't put it on the dashboard in the sun either. Yeah,
we want it to be as close to human conditions as possible. And that is hard doing that outside of a collection room, like 30 minutes away. That is hard, but you do have to deal with what you're comfortable with.
Right.